Hello, my name is Heun, I'm a consultant psychiatrist, and today I want to talk about seasonal affective disorder. This is a bit of a difficult one because it's not really always recognized, and the criteria, what seasonal, is very, very difficult. Usually it's also difficult what type of treatment would be the best. There are some differences between the different diagnostic criteria of DSM-5, which is a diagnostic and statistical manual which is used in America, and the International Classification of Diseases, which is ICD-10 or 11. So usually what must be there is a seasonal pattern of a recurrent depressive disorder. Recurrent depressive disorder is when you have more than one episode. Usually most people would have 10, 20, but you would also call it recurrent depressive disorder if it's twice or three times. So the question is, what would be then seen as seasonal? Some patients might have their episode of depression during the dark times. In the northern hemisphere, it said it might be January or February. However, the darkest days are usually around December. So the question, some people even would say it has to do something with the stress of Christmas or after Christmas. And so usually when you have seasonal depression, there might be more moderate than recurrent depressive disorder without seasonal episodes. Usually you have low self-esteem, you might have some hypersomnia, fatigue, low appetite. So these are common symptoms. Weight gain, changed and reduced social functioning. So it's a bit unclear whether where this comes from. Some people say in melatonin is increased or changed, and that the lack of light might change the proliferation or the metabolism of melatonin. However, other people would say that's more or less a cultural issue. It's usually quite uncommon to find very clear patterns. Some people would say, yeah, I have more depression in winter, it starts. But some people might also say, it starts in the sunshine in summer. And some people might have a seasonal affective disorder in June, July. So it's not very clear whether it must be dark in the time. So usually there is more females, 5 times more females than men having seasonal affective disorder. And the treatment, as you might be expecting, is something to do with light. So people try to give bright light. They have these lights or neon lights, which just are very bright and should be taken in the morning, at least for 5 days or so. If you have a response, it should come within, let's say, 2-3 weeks. Then if that's working, people would take or would consider some maintenance therapy, which could be 30 minutes every day, and but then usually to try to get the normal rhythm in the day, you would have to try the bright light in the morning or in the day, but then not trying to have it in the evening. Usually there's some good prognosis when people have hypersomnia or carbohydrate craving or reduced energy in the afternoon. So when there's something which might have to do with the changes of light. Right, there is some medication. SSRIs is what we would prescribe in Britain. Bupropion is licensed in the US, but you could try it off license in this country if you have a good argument for that. Some other things, try some other medications are propranolol in the morning to suppress morning melatonin, or agomelatine is a medication which affects the melatonin receptors, and it's an antidepressant. That might be an option. It helps usually with sleep. Mirtazapine, reboxetine, duloxetine, and moclobemide could be tried, but that's more try and error. And sometimes, sometimes CBT might be helpful, which possibly might be about regulating the daytime rhythm. So, but there isn't any evidence that a specific seasonal affective disorder would respond differently from other depressions in respect to CBT. Right, so that's it. We have some interest in this, and we will continue our series Mental Health Disorders Explained, and they're usually for interested people and students and doctors who want to have a bit of a reminder from time to time. Right, okay, have a nice day, and thanks for your interest.